These are the medical uses of cannabis. Neurological uses. Cannabis is effective for treating chronic pain in adults. Cannabis products are opioid-sparing, meaning they can help reduce dosages or even eliminate the need for opioid drugs like morphine and methadone. When patients on opioids also use cannabis, their opioid doses are typically reduced or stopped altogether. However, more research is needed to clarify optimal dosages. Vaping may provide immediate pain relief. For chronic pain throughout the day, capsules or edibles offer longer-lasting effects. While CBD is important for treating epilepsy, emerging evidence suggests that full extract cannabis oils, particularly those containing small amounts of THC, reduce seizure frequency more effectively than CBD alone. Cannabis can reduce spasticity caused by brain and spinal cord injuries, stroke, and motor neuron disease. It relieves muscle spasms and reduces pain. Other spasticity medications like baclofen and tizanidine are effective but often cause significant side effects such as fatigue and weakness. Although there is some theoretical evidence that cannabis may help certain aspects of Parkinson's disease, high-quality evidence remains limited. Cannabinoids are neuroprotective in dementia and may slow neurodegeneration. Studies suggest THC can reduce amyloid buildup, a key marker of Alzheimer's disease. It also inhibits the enzyme acetylcholinesterase, which may modestly slow disease progression. THC has been shown to reduce disturbed behavior, decrease agitation, and improve sleep duration. Research suggests that a single dose of THC is effective and safe for treating tics and obsessive-compulsive behavior in Tourette's syndrome. Cannabis for mental health. Depression and anxiety. CBD oil can be used to treat depression with or without anxiety. CBD can reduce anxiety while THC can induce it. For example, taking 20 to 30 milligrams of CBD per day. As always, each patient is different. Post-traumatic stress disorder, PTSD. Studies found that the synthetic cannabinoid nabilone significantly decreased trauma-related nightmares compared to placebo. Further research needs to establish whether nabilone can target other symptoms of PTSD such as flashbacks and hypervigilance in addition to nightmares. Studies show that nabilone is a safe, effective treatment for PTSD. Research also suggests that people with PTSD are more likely to use cannabis. In 2011, a survey of almost 6,000 adults in North America found that individuals with PTSD had significantly increased cannabis use. Psychosis. The initial diagnosis of substance-induced psychosis is often a misdiagnosed onset of schizophrenia, as heavy substance use in this group of patients leads to inaccurate diagnosis. Cannabis-induced psychosis must still be considered an important risk factor for developing schizophrenia in vulnerable adults, but how this applies to low THC, high CBD supervised medical cannabis products remain unclear. Cannabis for nausea and vomiting. Cannabinoids are useful for people with chemotherapy-induced nausea and vomiting that have not responded to other anti-nausea medications. Both THC and CBD have anti-nausea effects. No studies have yet determined which is better for controlling nausea, or whether a full extract cannabis oil is preferable. Cannabis for sleep. Both CBD and THC dominant strains can improve sleep. It is unclear which is most effective, as with many other indications. A capsule or edible form with an effect lasting through the night may be the best form of cannabis medicine for sleep problems such as uninterrupted sleep, fragmented sleep, multiple awakenings, and early morning awakening. A vaped form of cannabis may help patients who only have trouble falling asleep but sleep well once asleep. The vaped form wears off in a few hours, so it has little or no hangover effect in the morning for patients who may be sensitive due to metabolic differences. CBD is also useful for fibromyalgia, appetite stimulation, suppression, and inflammatory bowel disease.